All right, so I'm here with Stephanie and Nicholas, and Stephanie, you're going to just tell us a little bit about why they first started coming in, and why, Stephanie, why you brought Nick in.
Ever since Nick was taken off of breast milk at 1, we introduced cow's milk. He started vomiting on a regular basis, and it just continued to him always be sick. Then went into ear infections, always a sore throat, belly aches really bad, and it's just continued on. And as he got older, then we took him to the doctor to have him tested for food allergies.
Sure.
Found that he was allergic to nothing really, and they even scoped him and said his stomach was perfect.
And so he was still having lots of digestive problems, though, right? Lots of digestive stress.
Yes.
From the time he was 1. And how old are you now, Nicholas?
11.
11. So that's a long time.
And even as a baby, he did not sleep well.
Right.
Lots of sleepless nights.
Okay. And so what, over the years, what's that been like just in terms of just day-to-day living?
It was pretty miserable, especially for Nick, because he would wake up 3-4 times a night, wake up exhausted. We missed a lot of school because of it. Very stressful, for him, trying to keep up and make up all the schoolwork. And also for me, because I watched him literally bent over in pain all the time, tried to keep a food log. It didn't matter, because one day it would hurt him and the next day it wouldn't. And we just didn't know what it was.
And I think a lot of parents don't realize that, every parent just wants their children to feel good. And so in that effort of trying to obviously help them feel better, what do we typically do? We obviously take our children, they get antibiotics, and then the more antibiotics, and then ear infections, antibiotics for ear infections, antibiotics for the respiratory tract infections. And then what happens is all those antibiotics really start to change the environment of our GI terrain, the gut flora. And that leads to many different health problems, obviously, down the road. But so fast forwarding a little bit, so tell us, Nicholas, what have you noticed since, we've done the testing with you, and obviously the treatment, the changes in your diet. Tell us a little bit about how you're feeling nowadays.
I've been sleeping a lot better. I feel better. I'm still a little tired, but I can feel like I can get up more and be active more.
That's awesome.
I feel better. Yeah, it feels better, actually.
And you used to wake up every night with your pillow soaking wet.
Exactly.
His whole hair, everything would be wet from sweating. And now we don't have that.
I don't sweat as much as in the night.
Have you even noticed a difference in your skin?
And how's your stomach? How does it feel now
Feels
compared to
much better.
Months ago?
Better.
So a lot of belly aches, what's happened with those?
That's almost gone.
Almost gone.
Pretty much gone. Yeah.
So that's just a great testimonial to the fact that hey, when we give the body what it needs, it can really heal itself, and that's what's so awesome. Well, hey, I want to thank you for sharing just some of the things, your past health history with us, and obviously how much better you feel since we've started care with you. And we're proud of you, because we know there's been some tough changes that you had to make, but we know that you did it, and so we're really, really proud of you.
Thank you.
All right. Well, thanks for doing this. Take care.
Thank you.